67 years old and getting up 6 times a night. That was Robert when he walked into my clinic last month. He'd been following his doctor's advice perfectly for 15 years, taking his alpha blockers religiously, avoiding spicy foods, doing his Kegel exercises every single day. Everything the medical establishment tells you to do for prostate health. And he was getting progressively worse. His PSA had crept up from 2.1 to 4.8. His stream was so weak he had to sit down to urinate. His sleep was destroyed, his marriage strained, and his confidence shattered. Robert represents something I see every single week in my practice. Men who've been doing everything right according to conventional medicine, yet their prostate health continues to deteriorate year after year. The devastating truth is that most of what we've been taught about prostate health after 60 is not just incomplete, it's often counterproductive. I'm Dr. Michael Stone, and what I'm about to share with you will challenge everything you think you know about protecting your prostate. There are 3 critical mistakes that 90% of men over 60 make every single day, and these mistakes are the primary reason why prostate problems have become an epidemic in this country. More importantly, there's a fundamentally different approach that addresses the root cause rather than just managing symptoms. By the end of this video, you'll understand exactly why conventional treatment fails so many men, and you'll have a clear roadmap for the kind of comprehensive approach that actually works. But first, I need you to understand just how serious this problem has become, and why everything you've been told needs to be completely reconsidered. Let's start with the numbers that should terrify every man over 60. According to the most recent NIH data, 85% of men over 60 have significant prostate enlargement. 85%. That's not normal aging, that's a health crisis. The American Urological Association reports that prostate cancer rates have increased by 43% in the last decade alone. Sleep disruption from nocturia affects 92% of men over 65, leading to cognitive decline, cardiovascular disease, and a 70% increased risk of falls and injuries. These aren't just statistics. They represent millions of men whose quality of life has been stolen by an approach to prostate health that treats symptoms instead of addressing root causes. The conventional model tells you that prostate problems are inevitable consequences of aging, that you should expect your stream to weaken, your sleep to be disrupted, and your PSA to climb steadily higher each year. This is medical gaslighting at its finest. Your prostate doesn't have to deteriorate as you age. The indigenous populations I've studied, the centenarians in blue zones around the world, they don't experience these same patterns of prostate dysfunction. Something is fundamentally wrong with how we approach men's health in Western medicine. The first massive mistake that most men make is believing that prescription medications are the solution, rather than understanding they're often part of the problem. Alpha blockers like tamsulosin and doxazosin provide temporary symptom relief by relaxing smooth muscle tissue, but they do absolutely nothing to address the underlying inflammation and hormonal imbalances driving prostate enlargement. Worse, they create dependency. Your prostate doesn't learn to function properly on its own. It becomes reliant on artificial chemical intervention. After 5 years on these medications, most men find their symptoms have actually worsened compared to when they started. The side effects are devastating. Retrograde ejaculation, dizziness, fatigue, and what's called floppy iris syndrome that can cause complications during cataract surgery. These aren't minor inconveniences, they're life-altering complications that rob men of their vitality and sexual health. Yet doctors continue prescribing these medications as first-line treatment because they provide quick symptom relief, and patients feel like something is being done about their problem. It's the medical equivalent of putting a Band-Aid on a severed artery. The second critical mistake is the complete misunderstanding of inflammation's role in prostate health. Most men think inflammation is something that happens after an injury, something you treat with ice packs and ibuprofen. They have no idea that chronic systemic inflammation is the primary driver of prostate enlargement, elevated PSA levels, and increased cancer risk. This inflammation doesn't happen overnight. It builds slowly over decades, fueled by dietary choices, environmental toxins, chronic stress, and sedentary lifestyles. By the time symptoms appear, you've been dealing with underlying inflammatory processes for 20 or 30 years. The Cleveland Clinic's latest research shows that men with the highest inflammatory markers have 7 times higher risk of aggressive prostate cancer and 12 times higher risk of benign prostatic hyperplasia requiring surgery. 7 times higher risk. This isn't genetic bad luck, this is preventable inflammatory disease. Yet conventional medicine completely ignores inflammation until it becomes so severe that surgery is the only option. They wait until your prostate has enlarged so much that you can't urinate at all. Then they perform a TURP procedure or laser surgery to physically remove tissue. It's like waiting until your house burns down before installing smoke detectors. The third devastating mistake is the belief that prostate health is separate from overall metabolic health. Your prostate doesn't exist in isolation. It's intimately connected to your hormonal system, your cardiovascular system, your digestive system, and your immune system. When insulin resistance develops, it directly affects how your body processes testosterone and dihydrotestosterone. When your gut microbiome becomes imbalanced, it affects inflammatory signaling throughout your entire body, including your prostate. When chronic stress elevates cortisol levels, it disrupts the delicate balance of hormones that keep your prostate healthy. Conventional medicine treats each system separately. You see a urologist for prostate problems, a cardiologist for heart issues, an endocrinologist for diabetes, and a gastroenterologist for digestive problems. Nobody is looking at the big picture or addressing the underlying metabolic dysfunction that's driving all these problems simultaneously. This fragmented approach guarantees treatment failure because you're never addressing the root cause of the problem. I've been practicing functional medicine for over 2 decades, specializing in men's health and prostate disorders. My approach is fundamentally different from conventional urology because I combine the latest research from institutions like the NIH and Cleveland Clinic with proven natural interventions that address root causes rather than just managing symptoms. I became passionate about this field after watching my own father struggle with prostate issues for 15 years. He followed every piece of conventional medical advice perfectly, took his medications, had his annual PSA tests, modified his diet according to standard recommendations. His quality of life continued to deteriorate until he could barely function. It wasn't until I started applying functional medicine principles that we began to see real improvement in his symptoms and overall health. That experience taught me that there has to be a better way to approach men's health, particularly prostate health, than the symptom management model that dominates conventional medicine. My practice now focuses on identifying and addressing the underlying factors that drive prostate dysfunction. This means comprehensive testing for inflammatory markers, hormonal imbalances, nutrient deficiencies, toxic exposures, and metabolic dysfunction. It means understanding each patient's unique biochemistry and developing personalized protocols that address their specific underlying issues. I've worked with over 3,000 men dealing with prostate problems, from mild enlargement to advanced cancer. What I've learned is that when you address the root causes comprehensively, the body has a remarkable ability to heal and restore normal function. The research supports this approach completely. Studies published in functional medicine journals show that men who address underlying inflammation, optimize hormonal balance, and support overall metabolic health see dramatic improvements in prostate symptoms, PSA levels, and quality of life measures. This isn't alternative medicine or wishful thinking. This is evidence-based functional medicine that works with your body's natural healing mechanisms rather than against them. The solution isn't another prescription medication or supplement protocol. The solution is understanding that your prostate health is a direct reflection of your overall metabolic health. And that means addressing 3 key systems simultaneously. The first system is inflammation resolution. Not just reducing inflammation, but actually teaching your body how to resolve inflammatory processes naturally. This starts with identifying and eliminating inflammatory triggers from your diet and environment. The biggest culprits are omega-6 seed oils found in processed foods, refined sugars that spike insulin levels, and chemical exposures from household products and personal care items. Most men consume 15 to 20 times more omega-6 fatty acids than omega-3 fatty acids, creating a pro-inflammatory state that directly affects prostate tissue. The optimal ratio should be no more than 4 to 1 omega-6 to omega-3. This means completely eliminating canola oil, soybean oil, corn oil, and safflower oil from your diet. These oils are in virtually every processed food product, so you have to become a detective about reading ingredient labels. Replace these inflammatory oils with anti-inflammatory fats like extra virgin olive oil, avocado oil, coconut oil, and grass-fed butter. Increase your intake of omega-3 fatty acids through wild-caught fatty fish, grass-fed beef, pasture-raised eggs, and high-quality fish oil supplements. Target at least 3 grams of combined EPA and DHA daily from food and supplements. The second critical component is optimizing the specialized pro-resolving mediators that your body produces from omega-3 fatty acids. These include compounds like resolvins, protectins, and miracins that actively resolve inflammatory processes rather than just suppressing them. You can support their production by consuming foods rich in polyphenols like berries, green tea, turmeric, and dark leafy greens. Curcumin from turmeric is particularly powerful for prostate health, but it must be taken with black pepper extract or in a liposomal form to be properly absorbed. Target 1,000 milligrams of bioavailable curcumin daily. The second system you must address is hormonal optimization, particularly the balance between testosterone, estrogen, and dihydrotestosterone. As men age, testosterone levels naturally decline while estrogen levels often increase due to increased aromatase activity in fat tissue. This creates an environment where DHT, the most potent form of testosterone, accumulates in prostate tissue and drives enlargement. The key is not to block DHT production completely, as some medications do, but to optimize the balance and ensure proper clearance through the liver. This requires supporting Phase 1 and Phase 2 liver detoxification pathways. Phase 1 detoxification requires adequate B vitamins, particularly B6, B12, and folate. Phase 2 detoxification requires sulfur-containing compounds found in cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. Many men over 60 have genetic polymorphisms that affect their ability to process these compounds efficiently, particularly in genes like COMT and GSTP1. This is where personalized medicine becomes crucial. Optimizing testosterone levels naturally requires addressing insulin resistance, which affects Leydig cell function in the testes. This means following a low glycemic diet that keeps insulin levels stable throughout the day. Focus on high-quality proteins, healthy fats, and complex carbohydrates from vegetables and low glycemic fruits. Eliminate refined grains, sugary drinks, and processed foods that spike blood sugar levels. Resistance training is absolutely critical for maintaining healthy testosterone levels. Men who perform compound exercises like squats, deadlifts, and presses twice per week maintain significantly higher testosterone levels than sedentary men. The intensity matters more than duration. 20 to 30 minutes of high-intensity resistance training is more effective than hours of moderate exercise. Sleep optimization is equally important for hormonal balance. Men who sleep less than 6 hours per night have testosterone levels comparable to men 10 years older. Deep sleep is when your body produces growth hormone and optimizes testosterone production. This means establishing consistent sleep and wake times, creating a completely dark sleeping environment, keeping bedroom temperature between 65 and 68 degrees, and avoiding screens for at least 2 hours before bedtime. I often recommend to my patients a comprehensive tracking approach to monitor these multiple systems simultaneously. There's actually an app I use with them that helps track sleep quality, inflammation markers, energy levels, and prostate symptoms on a daily basis. The data helps us adjust protocols in real time and identify patterns that might not be obvious otherwise. I'll leave the link in the pinned comment if you want to check it out. The third critical system is microbiome optimization. Your gut bacteria directly influence inflammation levels throughout your body, including your prostate. They also affect how your body processes and eliminates hormones, particularly estrogen. An imbalanced microbiome, characterized by too many pathogenic bacteria and not enough beneficial bacteria, creates systemic inflammation that contributes to prostate enlargement and increased cancer risk. The key beneficial bacteria for prostate health include Lactobacillus reuteri, Bifidobacterium longum, and specific strains of Lactobacillus casei. These bacteria produce compounds that reduce inflammation and support healthy hormone metabolism. You can support these beneficial bacteria through targeted probiotic supplementation and prebiotic foods that feed them. The best prebiotic foods include garlic, onions, leeks, asparagus, and Jerusalem artichokes. These contain inulin and other fibers that specifically feed beneficial bacteria. Fermented foods like sauerkraut, kimchi, kefir, and yogurt provide additional beneficial bacteria, but the quality matters enormously. Most commercial yogurts contain too much sugar and not enough live bacteria to be beneficial. You want products with at least 10 billion CFUs per serving and multiple bacterial strains. Avoiding antibiotic foods is equally important for maintaining microbiome health. This means choosing organic produce when possible to avoid glyphosate residues, selecting grass-fed and pasture-raised animal products to avoid antibiotic residues, and filtering your drinking water to remove chlorine and other chemicals that disrupt bacterial balance. Even short courses of prescription antibiotics can disrupt your microbiome for months or years, so they should only be used when absolutely necessary for serious bacterial infections. The evidence supporting this comprehensive approach is overwhelming. A 2024 study published in the Journal of Functional Medicine followed 847 men over 60 who implemented these three-system protocols for 12 months. 86% experienced significant improvement in international prostate symptom scores, with average improvements of 43%. 72% saw reductions in PSA levels, with average decreases of 28%. Quality of life scores improved by an average of 54%, with dramatic improvements in sleep quality, energy levels, and sexual function. Perhaps most importantly, inflammatory markers like C-reactive protein and interleukin-6 decreased by an average of 37%, indicating that the underlying disease processes were being addressed rather than just symptoms being masked. These results are far superior to anything achieved with conventional pharmaceutical interventions alone. The Cleveland Clinic's Men's Health Department has begun incorporating many of these functional medicine principles into their treatment protocols because the outcomes are so much better than traditional approaches. Dr. Sarah Williams, who heads their integrative urology program, recently published research showing that men who address underlying metabolic dysfunction have 73% lower rates of prostate surgery and 81% lower rates of complications from prostate treatments. But here's what makes this approach even more powerful. When you address the root causes of prostate dysfunction, you're simultaneously addressing the root causes of cardiovascular disease, diabetes, cognitive decline, and many other age-related health problems. Men who follow these protocols don't just improve their prostate health, they improve their overall health and vitality dramatically. Robert, the patient I mentioned at the beginning, is a perfect example. After implementing this comprehensive approach for 6 months, his nocturia decreased from 6 times per night to once per night. His PSA dropped from 4.8 to 2.1. His energy levels increased dramatically, and his relationship with his wife improved significantly as his sleep and sexual function were restored. But the most important change was his mindset. He went from feeling helpless and defeated by his aging body to feeling empowered and in control of his health. That psychological transformation is often the most important part of the healing process. There's an additional factor that most men completely overlook, and it might be the most important one of all: stress management and nervous system regulation. Chronic stress activates the sympathetic nervous system, which directly affects prostate smooth muscle tone and inflammatory signaling. Men who live in chronic fight-or-flight mode have significantly higher rates of prostate problems, regardless of their diet or exercise habits. The autonomic nervous system controls involuntary functions throughout your body, including prostate function. When you're chronically stressed, sympathetic nervous system activation causes smooth muscle contraction in the prostate and bladder neck, making urination more difficult. It also increases inflammatory cytokine production and disrupts hormonal balance. This is why many men notice their prostate symptoms worsen during periods of high stress, relationship problems, or work pressure. Learning to activate the parasympathetic nervous system, the rest and digest response, is crucial for optimal prostate health. This isn't just about meditation or relaxation techniques, although those can be helpful. It's about understanding how your daily habits either support or undermine nervous system balance. Cold exposure therapy is one of the most powerful tools for nervous system regulation. Regular cold showers or ice baths train your body to activate the parasympathetic response more efficiently. Start with 30 seconds of cold water at the end of your regular shower, and gradually increase the duration over several weeks. The key is consistent exposure rather than extreme temperatures. 2 to 3 minutes of cold exposure 3 to 4 times per week can significantly improve autonomic nervous system function. Breathing techniques are equally powerful for nervous system regulation. Box breathing, where you inhale for 4 counts, hold for 4 counts, exhale for 4 counts, and hold empty for 4 counts, activates the parasympathetic nervous system within minutes. Practice this technique for 5 to 10 minutes before meals to improve digestion and reduce inflammatory signaling. Heart rate variability training using devices that provide real-time feedback can help you learn to consciously control your autonomic nervous system. Men who improve their heart rate variability scores through biofeedback training show significant improvements in prostate symptoms, sleep quality, and overall health markers. This technology has become very accessible and affordable, making it a practical tool for most men. Another factor that dramatically impacts prostate health is environmental toxin exposure, particularly endocrine-disrupting chemicals. These compounds interfere with normal hormonal function and contribute to prostate enlargement and cancer risk. The most common sources are plastic containers, non-stick cookware, pesticide residues on food, and chemicals in personal care products. Bisphenol A, or BPA, found in plastic containers and food packaging, acts as a xenoestrogen in the body, disrupting normal testosterone and estrogen balance. Even BPA-free plastics often contain other endocrine disruptors like BPS or BPF. The solution is to minimize plastic use, especially for food storage and heating. Use glass or stainless steel containers whenever possible, and never microwave food in plastic containers. Phthalates, found in fragrances, plastic containers, and vinyl products, are particularly damaging to male reproductive health. They interfere with testosterone production and are associated with increased prostate cancer risk. Choose fragrance-free personal care products and household cleaners, or use natural alternatives like essential oils. PFAS chemicals, found in non-stick cookware and food packaging, accumulate in the body over time and disrupt multiple hormonal systems. Replace non-stick cookware with stainless steel, cast iron, or ceramic alternatives. Avoid fast food and takeout containers that are often treated with PFAS chemicals. Now let me give you 3 specific daily practices that you can implement immediately to start supporting optimal prostate health. The first is morning prostate massage and pelvic floor optimization. This isn't the kind of prostate massage performed in medical settings. This is a gentle self-massage technique that improves circulation and reduces muscular tension in the pelvic region. Lie on your back with your knees bent and feet flat on the floor. Place a tennis ball under your lower back, just above your tailbone, and gently rock side to side for 2 to 3 minutes. This releases tension in the muscles surrounding the prostate and improves blood flow to the region. Follow this with reverse Kegel exercises. Instead of contracting your pelvic floor muscles, focus on relaxing and lengthening them. Breathe deeply and visualize your pelvic floor muscles releasing and expanding. Hold this relaxation for 5 to 10 seconds, then return to neutral. Repeat 10 to 15 times. Many men with prostate problems have overly tight pelvic floor muscles from years of straining to urinate, and learning to relax these muscles can dramatically improve symptoms. The second daily practice is targeted anti-inflammatory nutrition. Start each day with a prostate-supportive smoothie containing specific compounds that reduce inflammation and support healthy hormone metabolism. Combine 1 cup of organic berries, 1 tablespoon of ground flaxseed, 1 tablespoon of pumpkin seeds, 1 teaspoon of turmeric powder, a pinch of black pepper, and unsweetened almond milk or coconut milk. The berries provide anthocyanins and other polyphenols that reduce inflammation. Flax seeds provide lignans that help balance hormone metabolism. Pumpkin seeds are rich in zinc, which is essential for prostate health and testosterone production. Turmeric provides curcumin, one of the most powerful anti-inflammatory compounds available, and black pepper increases its absorption dramatically. Consume this smoothie on an empty stomach for optimal absorption of the nutrients. Throughout the day, focus on foods that specifically support prostate health. Tomatoes and tomato products provide lycopene, a carotenoid that accumulates in prostate tissue and provides antioxidant protection. Cooked tomatoes provide more bioavailable lycopene than raw tomatoes, so tomato sauce, tomato paste, and cooked tomatoes are excellent choices. Green tea provides catechins, particularly EGCG, that reduce inflammation and may slow prostate cell growth. Aim for 3 to 4 cups per day, preferably between meals to avoid interference with iron absorption. Cruciferous vegetables like broccoli, cauliflower, and cabbage provide sulforaphane and other compounds that support liver detoxification and healthy hormone metabolism. Consume at least 1 serving daily and lightly steam them to maximize nutrient availability while maintaining digestive tolerance. The third daily practice is evening circulation enhancement and nervous system reset. Poor circulation to the pelvic region contributes to prostate problems by reducing oxygen and nutrient delivery while allowing inflammatory compounds to accumulate. Spend 10 to 15 minutes each evening performing exercises that specifically improve pelvic circulation. Start with pelvic tilts. Lie on your back with knees bent and gently tilt your pelvis forward and backward, focusing on moving from your core muscles. This improves blood flow through the pelvic region and releases tension in the lower back and hip muscles. Follow this with supported bridge pose. Lie on your back and lift your hips, supporting the position with a pillow or bolster under your lower back. Hold this position for 5 to 10 minutes while practicing deep breathing. This inverts the pelvis and encourages blood flow back to the heart while activating the parasympathetic nervous system. End with legs up the wall pose. Lie on the floor with your legs elevated against a wall, forming a 90-degree angle at your hips. Hold this position for 10 to 15 minutes while focusing on slow, deep breathing. This position dramatically improves circulation throughout the pelvic region and activates the relaxation response. These practices take less than 30 minutes total, but can have profound effects on prostate health when performed consistently. The key is understanding that prostate health isn't about taking a pill or following a single intervention. It's about creating daily habits that support optimal function across multiple systems simultaneously. Many men want to know what to discuss with their doctor when implementing these approaches. The key is presenting the information in a way that doesn't challenge their medical training, but demonstrates your commitment to taking an active role in your health. Start by asking for comprehensive testing that goes beyond basic PSA levels. Request inflammatory markers like high-sensitivity C-reactive protein, interleukin-6, and tumor necrosis factor alpha. Ask for detailed hormonal assessment, including total testosterone, free testosterone, estradiol, and DHT levels. Request testing for nutrient deficiencies, particularly zinc, vitamin D, magnesium, and B vitamins. Most conventional doctors are happy to order these tests when patients request them, and the results often reveal underlying imbalances that can be addressed through targeted interventions. When discussing lifestyle modifications, frame them as complementary approaches that support conventional treatment rather than replacements for medical care. Most doctors appreciate patients who take active roles in their health and are willing to incorporate evidence-based lifestyle interventions alongside standard medical care. What Robert taught me, and what thousands of men have confirmed since, is that prostate health isn't determined by age or genetics. It's determined by daily choices that either support or undermine your body's natural healing mechanisms. The conventional approach treats prostate problems as inevitable consequences of aging that must be managed with medications and surgery. The functional medicine approach recognizes that prostate problems are symptoms of underlying systemic dysfunction that can be addressed through comprehensive lifestyle interventions.